Hi friends, welcome to our YouTube channel, One and Only Pharmacy. So friends, today's lecture we are discuss about Pharmacology chapter, Local Anesthetics. So friends, I request you to all please watch this video till the end. Let's start the chapter. Topics covered under this video. In today's lecture we are discuss about following topics. Which one? Definition of local anesthetic, properties of local anesthetic, classification of local anesthetic, mechanism of action of local anesthetic, pharmacological action of local anesthetic, and last point, techniques used for producing local anesthesia. First, definition of local anesthetics. These are the drugs which when administered in appropriate quantity, they reversibly blocks the nerve conduction of impulse and causes the loss of sensation in the area of application without affecting the degree of consciousness. These are the very simple definition of local anesthetics. Once again I repeat, these are the drugs which when administered in appropriate quantity, they reversibly blocks the nerve conduction of impulse and causes the loss of sensation in the area of application without affecting the degree of consciousness. Example of local anesthetics, Procaine and Xylocaine. Next point, properties of local anesthetics. It should have both water and lipid solubility. It must be non-irritant. It should not produce systemic toxicity. It should have a quick onset of action. It should be stable. It should not produce any permanent damage to the nerve or tissue. The action produced by local anesthetic should be reversible. These are the simple properties of local anesthetics. Classification of local anesthetics. Local anesthetics generally classified into main two types. Which one? Ester type and second amide type. In ester type there are also two subtypes, benzoic acid ester and second one para amino benzoic acid ester. In benzoic acid ester example cocaine, amylocaine, and in para amino benzoic acid ester example procaine, amethocane, benzocaine, etc. Second main type amide type. First acetanilide derivatives example xylocaine and second quinoline derivatives example cincocaine. These are the very simple classification of local anesthetics. Sometimes in question paper only ask define local anesthetics and give its classification. Next point, mechanism of action. This is very important question about this chapter. Let's see. Local anesthetic blocks the nerve conduction of impulse. For generation of impulse, the action potential or depolarization, that is, influx sodium ion is required. Calcium ions controls the transport of sodium ions across the cell membrane. Local anesthetic prevent the depolarization by displacing calcium ions present on the cell membrane of the nerve. This loss of calcium ions prevents the depolarization, means prevents the influx of sodium ions. Ultimately, action potential or impulses does not get generated. Such a depolarizing prevention action of local anesthetics is known as membrane stabilizing action. Example, procaine and cocaine. Thus, the local anesthetics produces loss of sensation in the applied area by blocking of impulse generation or impulse conduction. Let's see again what is the mechanism of action of local anesthetics. This is very simple mechanism of action. Local anesthetic blocks the nerve conduction of impulses. For generation of impulse, the action potential or depolarization, that is influx sodium ion, is required. Calcium ions controls the transport of sodium ions across the cell membrane. Local anesthetics prevents the depolarization by displacing calcium ions present on the cell membrane of the nerve. This loss of calcium ions prevents the depolarization, that is, prevent the influx of sodium ions. Ultimately, action potential or impulses does not get generated. Such a depolarizing prevention action of local anesthetics is known as membrane stabilizing action. Example, procaine and cocaine. Next main point, pharmacological action of local anesthetics. There are two main actions. Action of the CNS means action of the central nervous system, and action of CVS, action of cardiovascular system. In action of the CNS, it has CNS depression action. It causes nervousness and sedation. Sometimes it also produces respiratory failure. In action of CVS, the high dose of local anesthetic leads to systemic absorption and produces some cardiac effect. It includes cardiac depression, bradycardia, cardiac arrest, and hypotension. These are the main two actions of local anesthetics. Next point, methods or techniques used for producing local anesthesia. Which which methods which we are used for producing local anesthesia, which are as follows. There are five types of methods, simple methods. First one, surface anesthesia. Second, infiltration anesthesia. Third, epidural anesthesia. Fourth, spinal anesthesia. And fifth, field block anesthesia. These are the five methods or techniques used for producing local anesthesia. Let's see one by one in detail. Surface anesthesia. What is surface anesthesia? Application of local anesthetic in the form of spray, solution, or cream to the skin or a mucous membrane. Example, cocaine, benzocaine, etc. Second main types, second main methods, infiltration anesthesia. Injection of local anesthetics into the tissue to be anesthetized. Surface and infiltration anesthesia are collectively topical anesthesia. Example, procaine and lignocaine. Third one, epidural anesthesia. A local anesthetics is injected into the epidural space where it acts primarily on the spinal nerve roots. Depending on the site of action and the volume injected, the anesthesia areas varies from limited areas of the abdomen. Fourth one, spinal anesthesia. A local anesthetics is injected into the cerebrospinal fluid, usually in the lumbar spine in the lower back. Example, amethocine. And last method, field block anesthesia. Subcutaneous injection of a local anesthetics in an area bordering on the field to be anesthetized. Example, procaine. Simple question, simple reason. Why adrenaline always administered with local anesthetic or procaine? Why adrenaline always administered with local anesthetics or procaine? Let's see the answer. Adrenaline is a sympathomimetic drug, whereas procaine is a local anesthetic. Adrenaline is a sympathomimetic drug, whereas procaine is a local anesthetic. Adrenaline is a vasoconstrictor, and procaine is a vasodilator. When the local anesthetics are administered, they produce vasodilation, which increases their systemic toxicity and decreases the duration of action. When adrenaline is administered with procaine, it causes vasoconstriction, which decreases the systemic toxicity and increase the duration of action of procaine. Hence, adrenaline is always administered with procaine. These are the simple question. Let's see revision once again. These are the simple chapters in pharmacology, local anesthetics. Let's see, today's lecture we are cover a local anesthetics definition, its example, properties of local anesthetics, which properties will be important for local anesthetics drug, classification of local anesthetics drugs. There are also main two types, ester type and amide type, which also include divided into two subtypes. Mechanism of action, pharmacological action of local anesthetics, action of the CNS and action of the CVS, methods or techniques used for producing local anesthesia. Generally, five methods which are used to producing local anesthesia, which as follows: surface anesthesia, infiltration anesthesia, epidural anesthesia, spinal anesthesia, field block anesthesia, etc. And this reason is very important for today's topic, why adrenaline always administered with the local anesthetic or procaine. Friends, if you like this video, then like this video, share and subscribe to our YouTube channel. Thank you friends. Let's see. Thank you.